We have some noted dentists from Harvard, Dr. Gregory An, who's a dentist, and we have Dr. Lisa Thompson, who is also a dentist, and you're both from Harvard, and you work and specialize in the geriatric, with the geriatric population. Are people keeping their teeth longer, Dr. Greg?
Definitely. One of the things that we are seeing in the trends of oral health in America is that people are keeping their teeth much longer into a much later stage in their lives. And traditionally, at the turn of the century, we would see that most older adults who were 65 and older would not have any teeth. But as the decades have progressed throughout the 1900s and now into the 2000s, in the 21st century, we find that older adults, they want to keep their teeth longer, and they are keeping their teeth longer due to a lot of public health initiatives, including the implementation of fluoride. And so it's a big challenge for the health community in terms of how we can treat our older citizens and maintain good oral health for them. By the time you're 85, if you have your teeth, that is truly successful. And that is one of our goals as clinicians and as oral health care providers. We want our patients to maintain their teeth, but also have good oral health throughout their lives. And you need that in order to keep your teeth by the time you're 85.
You know, Dr. Lisa Thompson, how interconnected are our teeth with the rest of our body and you know, their value? It's beyond a smile, isn't it?
Absolutely. You know, our mouth is where food enters, how we speak, and how we communicate with people. But it also is related to our overall systemic health as well. And they're finding different links to systemic diseases, to cardiovascular diseases, diabetes, and other things linked to the health of your teeth.
If I've got my teeth at 70, I don't need to see a dentist anymore, do I?
Absolutely you do. So not only can your teeth can continue to have cavities, you can have periodontal or gum problems as well. And so needing to see a dentist to address those issues, but also to have your mouth examined for oral cancer as well.
What we see, you know, nice white teeth, we started out with that, and what happens to our teeth? Why do they age, and how do they age?
So when we think about teeth, we have to look at it in two ways. One way is looking at healthy aging, and the other way is to look at as a disease process. When teeth age in a healthy fashion, we see that it is normal that the teeth will discolor with time. They may become more brittle. Even with healthy aging, that will occur. And so what occurs when you're looking at the teeth, there's four separate components of a tooth. There's the outer shell, which is called the enamel. It's the part of the tooth that shows when you smile. And there are parts of the tooth that we don't see. On the inside of the enamel is something called dentin, which is a yellower, softer material. It has all these little tubules, and underneath the dentin there are these cells that connected to the nerve of the tooth called the pulp. And so over time, what happens is that dentin actually starts to thicken and leaves less space for the nerve, the space where the nerve is, which is called the pulp. In an older adult, that pulp shrinks and the inner layer, the dentin, thickens. And so what happens is sensation declines over age. And so what used to be very sensitive when they were younger, for example, sensitivity to hot and cold, actually declines with age. And the fourth component of the tooth is the root section, the part that we don't see at all. It's embedded in the bone, and it connects the tooth to the bone through ligaments. And so this is called cementum. And so that's the fourth part, and that also thickens over age. So the only part that really thins out is the outer shell, the enamel. And when that thins out, it becomes yellower because we see the inner shell of the tooth.
Okay, so that a tooth is a pretty active little. Is it an organ? It's a live, living thing, right?
Absolutely. And so addressing the point made earlier, when a 70-year-old comes in and they have teeth, and they think that they don't need to see the dentist because they've reached success. That's not necessarily the case, because it's a live living organ that still needs to be taken care of. And a lot of times things that a patient or individual will do at home is not sufficient. And so it's always appropriate for them to see a professional, a dentist or another health professional, to make sure that there's nothing going wrong.